All right, this is the lecture on healthcare facility structure and organization. Most healthcare organizations use a top-down organizational format to show authority and responsibility as well as communication lines within that organization. Most healthcare organizations include the following organizational structures, and each of these are going to be discussed separately. They have a board of directors, they have an administrative staff, a medical staff, they have both therapeutic and diagnostic departments, they have other ancillary and support services, they have hospital committees and medical staff committees, and they use contracted services. This is an example of an organizational chart in an acute care hospital facility. It outlines the reporting or responsibility of the organization's leaders. As these entities are discussed throughout this lecture, you can use this graph as a visual picture to see the reporting responsibilities. You can see that the medical staff is separate from the hospital management staff. There's many different types of organizational charts, and this is just one example of one. Of course, the larger the organization, the more detailed the organizational chart may be. This is an example of a doctor's office organizational chart. It is much smaller because it has fewer layers of management and fewer employees. So the governing board. The governing board is also can be called the board of trustees, the board of governors, the board of directors, or the governing body. Its membership depends on the type of board it is. If it's a local board, which means the hospital is just a local hospital, it's usually made up of administrative staff, physicians, and some citizens within that community. If it's a corporate board, so that means if the hospital is part of a bigger corporation that has hospitals all over the country, they will have representations from those different areas of the country where their hospitals are located. Most of the time, the membership of the governing board serves on the governing board without pay. They volunteer their time and services. However, in some cases, the board members do receive a small stipend. The primary responsibility of the governing board is that they have ultimate legal authority over the functions and the activities within that healthcare facility. The board is responsible for all the hospital operations, and they're responsible for the quality of care that is being delivered at that healthcare facility. Their other responsibilities includes developing, with the collaboration of the other departments, missions and values of the healthcare organization. They select a qualified administrator or chief executive officer to manage the organization. They approve the organization and makeup of the clinical staff. They review hospital operations, and they ensure that that there's a qualified hospital staff, which means that the professional staff, the people that work there, the nurses, the occupational therapists, all meet competency standards. They also approve the medical staff appointments. The administrative staff serves as a liaison between the medical staff and the governing board. They develop a strategic plan with the board and the medical staff that supports the missions and goals of the organization. The administrative staff manages the finances, and again, they make sure that the hospital operations are in compliance with the law and standards. The administrative staff usually consists of a chief executive officer. He is the administrator who's, again, responsible to the board for whatever actions occur in that healthcare facility. The chief operating officer is responsible for overseeing usually specific departments. A lot of times it could be the ancillary departments, or it could be the clinical departments, like the lab director and the radiology director would all report to the chief operating officer. The chief financial officer, of course, is responsible for financial operations and the accounting, billing, payroll. Lots of times the health information management department reports to the chief financial officer because of the coding. The chief information officer is responsible for information resources, and it could be all of the computer systems, sometimes health information technology. The chief nursing officer, of course, is responsible for all of the nursing functions, and all the nursing departments report to that individual. In a big, large organization, they could have vice presidents. They can also have department directors, assistant vice presidents. Again, it depends on the size of the organization, how many layers of management they might have. The medical staff is the physicians. The medical staff is separate from the hospital staff. They have their own set of bylaws, which are rules that delineate what are the medical staff responsibilities. They have their own set of rules and regulations, like what procedures do they have to follow, and this could include, what should be in the health record, what's the timetable that those reports need to be in, that documentation needs to occur in the health record. And these are often based on federal and state regulations as well as accreditation agency standards. So the licensed physicians could be doctors. It could be other licensed providers based on state law that are granted, that are not employed by the facility but are granted privileges to practice there. It could be like a physician assistant, it could be nurse practitioners, it could be occupational therapists, it could be physical therapists, it could be social workers, psychiatrists, psychologists. So it's usually individuals who are not employed by the healthcare facility. Now, in today's world, some of the medical staff is employed by the healthcare facility. They are employees, but they still have their own functioning medical staff. So the medical staff diagnoses and treats patients. It has to be organized. So there's lots of times a clinical departments based on specialties. There's a medical executive committee that reports to the board, and this medical executive committee has officers such as the president of the medical staff, the vice chief of staff, secretary and treasurer of staff. They also have medical staff committees that have to monitor the quality of care that's being delivered by the members of the medical staff, and they have clinical privileges. So if a physician wants to do a certain procedure, he has to be qualified to do that, and he has to request those privileges. He says, I'm requesting to do laparoscopies. And so he has to show evidence that he's been trained and he has successfully performed laparoscopies in other settings or other hospitals. As far as the medical staff, clinical departments, there can, if it's a very small hospital, there might be two, medical and surgical. In a really large hospital, there could be many. There could be a neurosurgery department. There could be a cardiology department. There could be an OBGYN department, a pediatric department, a general surgery department, an anesthesia department. So it just depends on the size, again, of the medical staff. The medical staff, a physician can't just say, oh, now I'm on your medical staff. They have to apply for privileges to be on the medical staff. They have to apply for initial privileges, and then every 2 years they have to reapply to be on that medical staff, and they have to provide specific information, and there's a list in your book which I'm not going to read because you can read it, but it's quite extensive, the information they have to provide. They have to be verified to see that their names aren't on that National Practitioner Database or the Health Integrity Practice Data Bank. They have to request, like I said, specific privileges. They have to say, I want to perform these surgeries or these procedures. They have to show that they, what lawsuits that they have had, that they have malpractice insurance, that they have a drug enforcement agency license, they have a medical license that's up to date and there's no sanctions on it. Every application or every appointment to the medical staff, whether it's a doctor or some other type of healthcare provider, has to be approved by has to be reviewed by the medical executive committee and approved, and then it must be approved by the governing board. The governing board has the ultimate approval of who is appointed to the medical staff. Here's a sample medical staff organizational chart, and this is quite extensive. You can see that the chief of staff, which is reports to the this one has a board of managers. They have medical staff committees on the side. They have several departments: anesthesia, radiology, OBGYN, family practice, psychiatry. It's quite extensive. So, and you can see they have chairmans and vice chairmans. There are some hospital-based physicians that I want you to be aware of. A hospitalist works only in the hospital treating patients. This person could be a hospital employee, or they could be associated with a private physician practice, and they do all the hospital rounds for that physician's practice. A pathologist is the person who reviews the tissue of organs and blood products for the surgical patients, and usually is over the lab department. The anesthesiologist provides anesthesia to surgery patients, and then the radiologist review diagnostic imaging procedures. Now, even though they are employed by the healthcare organization, they still must be members of the medical staff. There's different membership categories in the medical staff. One thing I want you to be aware of is that the physician directs the patient care. Okay, the physician's the one who orders the treatments for the care, and the nurses or the other caregivers carry out those orders or those instructions, but the physician is responsible for the patient and directing the care of the patient. So the membership categories include active medical staff member with admitting privileges, and these are the individuals who deliver most of the medical services to the patients. You can have an associate membership category. These a lot of times are those physicians who've applied to the medical staff but have not gone through final approval, or sometimes they have a year-long orientation, or year-long that they have to be on the staff before they become true active members. It depends again on the bylaws of that organization. You have a consulting membership category, where these are physicians who don't usually admit, but they just provide expert opinions to other medical staff members. A lot of times the pulmonologists or dermatology, they're on the consulting staff. The courtesy staff means that they admit occasionally to the hospital. They don't admit enough to be active. And then the honorary are long-term medical staff members or former members that maybe are no longer in practice, so they're honorary members. So the departments now. Departments can be classified in several ways. You have diagnostic departments, therapeutic departments, ancillary departments, and so administrative departments. The ones who provide the care to the patient could be diagnostic or therapeutic. And what does that mean? So diagnostic means that it's being tested, that the patient's getting tested. They're trying to determine what is wrong with the patient. So diagnostic would be, departments would be like the lab, electroneurodiagnostic testing, that's nerves, testing for the nerves, radiology department, nuclear medicine department, respiratory therapy, although respiratory therapy could be therapeutic and diagnostic as well. They kind of do both, and so does radiology. And then sonography, which is the ultrasound or sonograms. Those are all considered diagnostic departments because they're looking at the patient in a way to see what can we find. Let's look at the patient to see what's wrong with the patient. Therapeutic are those departments that actually treat the patient. Nursing is the major therapeutic department. They provide most of the care to the patients in a hospital setting. Occupational therapy provides care. Those are the ones who do the small muscles or the small motor exercises. Physical therapy and rehab work on the large muscles, the being able to walk. Respiratory therapy, again, they do the therapeutic, the respiratory exercises, breathing, oxygen. Again, they can also do diagnostic work. They have the blood gases, the pulmonary function test, but they also provide therapy as well. Radiation therapy, where most cancer patients get some type of radiation therapy, and then speech and language pathology for those stroke patients. So these are therapeutics. They provide the treatment. Then there's the ancillary support services that are clinical in nature, like pharmacy. Okay, they're handing out the drugs. Food and nutrition services, again, dietary. Many patients are on special diets. Health information management, the medical records, social work and social services, case management, patient advocacy, environmental services, purchasing. They have to provide all the supplies, cleaning, environmental services, bioengineering, making sure the equipment, all those different medical pieces of medical equipment work, the medical library, and central sterilization is the department that sterilizes all of the equipment after it's been used by patients. Then you have the administrative support services like admissions, registration, which is called patient access by a lot of hospitals, the claims and billing departments, which are part of the revenue cycle departments, compliance department, accounting, payroll, information services, the computers, human resources, public relations, fund development. That's like a lot of not-for-profit hospitals have like children's, they receive funds from other ways through fundraising activities, marketing, risk management, performance improvement, the volunteers. Those would be all administrative support services. So hospital committees, many times the state laws and maybe the accreditation survey standards require certain hospital committees. The disaster committee is usually that committee that looks at how are we going to handle internal and external disasters. It could be, the electricity going out. It could be hurricanes, weather events. It could be a number of things, flooding. A pharmacy and therapeutics looks at the use of drugs. How are drugs being ordered? Are they being ordered appropriately? Are they being used appropriately? So they monitor drug utilization. The forms committee is the committee that looks at what are the forms that are being developed, making sure that they're not being, like Department A and Department B are developing the same form. So there's a centralized place to discuss forms development and approve the forms that are going to be used throughout the facility. This could be in the medical record and just regular forms. Infection control monitors infections within the hospital to see if there's any trends. Performance improvement looks at the quality of care being delivered not only by physicians but also by the hospital staff. Surgical care, again, looks at, are there any trends in the surgery department where we're doing, are the surgeries appropriate? Are there returns to surgery? Are there problems with surgeries? Any kind of adverse event that occurs during surgery, the surgery care committee might look at that. Utilization management looks at how are the resources within the organization being used. Are they being used appropriately? Are they needed? Are they medically necessary? Then the book talks about meetings. I guess after the these committees have meetings. So in healthcare, teamwork is essential. You have patient and non-patient teamwork. Performance improvement will have teams. Different, even within their own department, they'll have committee meetings or department meetings. Usually there's a committee chairperson, the person who's responsible for making sure the meeting occurs, making sure the members are notified. You have the committee members. You can have formal committees that are sanctioned through the Board of Trustees or through the Performance Improvement Committee, or you can have informal committees where maybe there's something that's been identified as an issue, and so you get together with a few people to try to see how can that issue be resolved. Committees have agendas. An agenda is a list of items that are going to be discussed at that committee meeting, and then the minutes are documentation of what occurred, any actions, suggestions, things that have been completed that have occurred at the meetings. So then they talk about the functions of the Health Information Management Department. I'll go through these really quick. Some hospitals have a cancer registry, some don't. Some cancer registries are separate from the Health Information Management Department. Some have one person who just does cancer registry, full-time or even part-time, and that's collecting data and sending it to the state cancer registry for their collection of statistics, and they use the statistics. Medical coding is looking at the diagnoses and procedures and assigning a standard code number to it. Again, that's used for reimbursement and for statistical reasons. Abstracting is taking information out of the record, going through a record, finding information and looking for trends. And we do a lot of reporting of quality of care, a lot of performance improvement reporting, and that's when you abstract the information out the chart. And you will do some abstracting in one of the later chapters. Image processing, that could be scanning paper records into an electronic health record system. Incomplete record processing, anytime there are individuals, analysis people who go through the health record and make sure that all the documents are there, make sure that they are timely, that they're signed. Even with electronic health records, they do that also. Medical transcription is individuals who the doctor may dictate their operative report or their discharge summary, and the transcriptionist will type it and then send it to the electronic health record for the doctor to review and sign. Record circulation, we don't see this as much, but with paper records, we saw where we had to keep track of where those paper records were. So if a patient was being seen in the emergency room and the ER doctor needed to see their old record, we would do the record circulation. We would sign out the record to the emergency room, or we sign out the record to the pathologist if he's doing an autopsy. That's with paper records. With electronic records, we don't need that record circulation, but what we do now is look at who saw that record. We do go in and monitor to see who's looking at the records. Are they supposed to be looking at the records? And then the release of information is individuals, insurance companies, lawyers, patients will send in saying we need a copy of our records. And so the release of information processes that request. There's laws, and we'll learn about this later on, that govern releasing information. You can't just give somebody's record to to anybody. You have to have an authorization from the patient. And they document that. They have to keep a list. There's laws that say that if a patient wants to see where their record was released, we have to provide them with a list of that. Again, we'll talk about that in a later chapter. Some of the contract services that are used within a healthcare facility, even the Health Information Management Department, nowadays the whole department could be under a contracted service. Many hospitals, I know East Jeff HIM department is under a contracted, is managed by another service, another organization, and the HCA hospitals like Tulane, Lakeside, and Lakeview, they are managed by Parallon. Sometimes the coding function, you might need some contract coders if you get behind in the coding function. In almost all the hospitals, the transcription function is outsourced under a contracted service. Release of information in almost all the hospitals, a contract service comes in and performs that function. So contract services means that the hospital pays another organization to come in and perform that function. Cancer and trauma registry, they might be under contract services. Lots of times the master patient index review, they'll contract another company to come in and do that master patient index review. Those are the HIM department ones. Within the whole hospital, a lot of times environmental services, the cleaning services, the dietary services, those could all be an outside agency that comes in and performs that service to the hospital for a fee. Physical therapy, speech therapy, you can have in smaller hospitals that don't need a big physical therapy department. They might contract with speech therapists, occupational therapists, and physical therapists to come in occasionally and do and perform services. Emergency medicine, a lot of times these emergency rooms are staffed by physicians that, again, work for a different company, even anesthesia sometimes. All right, so in summary, the organization of a healthcare facility and the medical staff depends on the size of the facility. Most basic services have to be offered, medical, surgical. You have to offer emergency care. You don't have to have an ER, but you have to be able to perform emergency care if someone shows up at your facility that needs emergency services. The governing board has ultimate authority of all the services provided. The physician directs the patient care, and healthcare involves teamwork.